The elbow complex. It's a joint really designed to provide increased mobility and function to the hand. Mobility is increased by providing a mechanism to shorten or lengthen the upper extremity so that we can reach behind us or reach over our head or reach behind our ears to scratch them. Besides mobility, the configuration of the elbow also provides substantial stability for activities that require forceful movements. The elbow complex consists of the humeral ulnar joint, the humeral radial joint, the proximal radial ulnar joint, and the distal radial ulnar joint. So let's take a look at the anatomy and some of the important bony landmarks so that we develop a better understanding of muscular attachments and muscular actions, and then we'll finish with looking at joint axes and normal motions that occur through the joint. So we're going to start with the humeral ulnar and the humeral radial joint. The articulating surface of the humerus includes the trochlea and the capitulum. The trochlea lies slightly anterior and distal on the humerus, and it articulates with the trochlear notch of the ulna. The trochlear groove here spirals obliquely around the trochlea and divides the trochlea into the medial and the lateral side. The medial side of the trochlea projects further distally than the lateral side of the trochlea does. So I have a little bit more distal projection of the medial trochlea than I do of the lateral trochlea. The capitulum articulates with the radial head and lies anterior and lateral on the aspect relative to the aspect of the humerus. We have some other important landmarks. Posterior, this large fossa is the olecranon fossa. We have a medial and a lateral epicondyle, which serves for multiple muscle attachments, which we'll get to in a bit. And then I have the radial fossa and the coronoid fossa, which is an area that allows for a projection of the radial head and of the trochlea of the ulna as we go into as we move into flexion. The articulating surface of the ulna and the radius corresponds to the humeral articulating surface. The ulnar articulating surface includes the trochlear notch, and the radial articulating surface includes the radial head. The trochlear notch is a concave semicircular surface that fits congruently on the trochlea. The radial head is a concave, slightly cup-shaped surface that articulates with the capitulum of the humerus. So the humeral ulnar joint is almost congruent, resulting in minimal slide with maximum amount of roll. An extension will occur all the way until the olecranon process hits the olecranon fossa, at which point we have a bone-on-bone stop. And that's why when we go take our elbow into full extension, we kind of have that hard end feel. Now flexion will continue until the coronoid process here reaches the coronoid fossa on the humerus. Now, occasionally in someone with a lot of soft tissue mass, we're going to we may end up with soft tissue approximation before we have a bony approximation. So that end field going into end range flexion may feel a little bit different. The radial head articulates with the capitulum, and it glides on the capitulum, primarily going into flexion. Very little or no contact exists between the radial head and the capitulum during extension. A couple of other landmarks that we need to be aware of is the biceps tuberosity, where the biceps brachii tendon attaches. So that is the articulating surfaces of the radial head and the trochlea of the ulna. The proximal elbow joint is enclosed by one joint capsule. It's primarily loose, and it's large and surrounds the entire joint. Now keep in mind that the joint, the elbow joint, is a hinged synovial joint. And there's some specific ligaments that we'll look at in a second that are thickened portions of the articular capsule that in fact surrounds the entire joint. So let's take a look at the capsule as it surrounds the entire joint. We can see from the anterior aspect to the posterior aspect in it the way that it surrounds the entire joint. And with as much motion that occurs in the elbow joint, we recognize that we need to have a pretty loose capsule to allow that motion to occur. The lateral reinforcement of the joint occurs with the radial collateral ligament or the lateral collateral ligament. It's really quite fan-shaped, so we can see a much wider distal attachment. It extends from the inferior lateral epicondyle of the humerus and attaches to the annular ligament here. It's the weaker of the two collateral ligaments and provides support against the varus forces that would occur through the elbow. The medial aspect of the elbow is supported by the ulnar collateral ligament. And the ulnar collateral ligament is triangular shaped, 3 bands that attach to the anterior medial epicondyle, the coronoid process, and the olecranon. So the anterior band provides resistance against valgus forces at the elbow when the elbows flex between 20 and 120 degrees. The posterior band of the ulnar collateral ligament provides a secondary role against valgus forces. And the transverse band, or the oblique band, of the ulnar collateral ligament provides resistance against distraction. So those are the 3 ligaments or portions of the medial or the ulnar collateral ligament. When I take a look at the radial ulnar joint, the primary supporting structure that maintains that rim of the radial head against the radial notch of the ulna is the annular ligament. And we can see the annular ligament as it wraps all the way around the radial head and keeps it cupped nicely against the radial notch of the ulna. So there's the radial notch of the ulna and the annular ligament maintaining that position. Now the ligament is cup shaped, so it's wider superior than it is inferior. So we probably have the best picture of how that provides that cup shaped appearance. So it makes it more difficult for a distractive force to pull the radial head out of its articulation against the ulna. Now, as I continue down and look at additional stability, we can see the oblique cord of the elbow. And as I continue to move distally, the interosseous membrane provides stability. The quadrate ligament, which is not visualized on my model here, and then I have the anterior and the posterior radial ulnar ligaments, which would provide stability distally. So when I look at the motion of the radial ulnar joint, that motion is that spinning motion of pronation and supination. So that cup-shaped articular surface of the radial head spins against the radial notch on the ulna. Let's dive into the muscles that cross the elbow joint. So starting with the elbow flexors, we can take a look at, from superficial to deep, the biceps brachii, which is divided into the long head and the short head. So with the long head, the origin is at the superior aspect along the supraglenoid tubercle of the scapula. So sometimes we think of the long head as actually being a humeral head depressor as well as an elbow flexor and shoulder flexor. So it inserts into the radial tuberosity and into the biceps aponeurosis, innervated by the musculocutaneous nerve from the nerve roots at C5 and C6. And it flexes and supinates the elbow, but also, as I said, it functions at the shoulder as well. Short head attaches superior at the coracoid process of the scapula and inserts into the radial tuberosity. So it has a common attachment with the long head. Innervated by the musculocutaneous nerve, and again, it primarily functions to flex and supinate the elbow, but we'll look and see what happens and what the biceps does in closed chain activities. Maybe a little bit different. So as I remove the biceps, I come down and take a look at the brachialis. And the brachialis is one of the four of the flexor muscles that really is truly, purely an elbow flexor. Its origin is on the anterior distal half of the humerus, and it inserts into the ulnar tuberosity and the anterior surface of the coronoid process of the ulna. Innervated by musculocutaneous nerve and a little branch off of the radial nerve. And it just flexes the forearm at the elbow. So this is that muscle that really doesn't matter what hand position or forearm position you're in, as it's truly just working at that hinge joint of the ulna against the humerus. The brachial radialis is an anterior flexor of the elbow, but is also a pronator of the forearm and a supinator of the forearm, depending on the position that the hand starts in. So it really takes the hand from a supinated position to a neutral position, or from a pronated position to a neutral position. Originates along the superior ridge above the lateral epicondyle and the lateral intermuscular septum. It inserts in the lateral side of the base of the styloid process of the radius. So it comes down and attaches at the base of the styloid process of the radius. Innervated by the radial nerve, and in addition to pronation and supination, it does flex the forearm at the elbow. So those are our elbow flexors. When I look at my elbow extensors, we come posterior, and I have the triceps, the lateral head, the long head, and the medial head. So it's a large posterior muscle that, in addition to its function at the elbow, also extends the shoulder. So the lateral head starts at the posterior surface of the body of the humerus, inserts into the olecranon process of the ulna, innervated by the radial nerve, and again extends the forearm at the elbow. The long head attaches at the infraglenoid tubercle or tuberosity of the scapula. It inserts into the olecranon of the ulna, innervated by the radial nerve, and again extension of the elbow and adduction at the shoulder and some extension at the shoulder. The medial head has its origin, and it's deep, and if I try to eliminate the long head and the lateral head, it takes all three heads away. So we just have to see the little portion of the medial head, starting on the posterior surface of the humerus, below the groove for the radial nerve, which the radial nerve will run obliquely across the posterior aspect of the humerus. Inserts, again, common insertion into the olecranon process. It's still innervated by the radial nerve, and really primarily just functions as a forearm extender. The anconeus is a little tiny muscle that helps to move the joint capsule out of the way. So it originates on the lateral epicondyle of the humerus and inserts on the olecranon and the proximal dorsal surface of the body of the ulna, but it has some attachments to help pull the joint capsule out of the way as we go into extension. So it extends the forearm at the elbow, but also functions to kind of work within the capsule. When I look at the muscles responsible for supination and pronation, I have the pronator teres. Pronator teres is a superficial muscle, medial epicondyle of the humerus and the coronoid process of the ulna, inserting into the lateral surface of the radius. Innervated by the median nerve, so it'll have a little bit of flexion activity, but also pronates the radius, moves the hand from that supinated position to the pronated position. So this small muscle that runs laterally, originating from the lateral epicondyle of the humerus, the ulna, and the radial collateral ligament and the annular ligament, so it has this broad attachment here, inserting into the dorsal and the lateral surface of the body of the radius, innervated by the deep radial nerve, is the supinator, and it's responsible for supination of the hand and the forearm by pulling the radius around the ulna. So in opposition to the pronator teres is the supinator. Distally, the pronator quadratus originates on the distal fourth of the anterior surface of the ulna and inserts into the distal fourth of the anterior surface of the radius. So it just runs right straight across, innervated by the interosseous branch of the median nerve, and functions to pull the hand into pronation. So the pronator quadratus and the pronator teres are our primary pronator muscles. The biceps brachii and the supinator are our primary supinator muscles.